last year, from January through March, I had to go off Xarelto because of the cost of it. It would have cost me hundreds of dollars, and I'm on Social Security. Is there any other drug that's available, like Eliquis or anything else? I am on aspirin and Plavix and Xarelto. I'm on all three. And I have a stent in my left.
Sorry, good.
I'm good.
Oh, so, honestly, do you know why did they put you on triple therapy? Because the data did not show any benefit by being on all three. We sometimes do that in patients who failed while on two. But was it because you failed on some treatment that they put you on all three?
No, my vascular surgeon, he wanted me to go on Xarelto, and I was on Plavix and aspirin. So I went off it for 3 months, but I was leery because, I keep saying, well, am I going to have a stroke or what's going to happen? So as Xarelto, Janssen has a program that starts April 1st to help financial aid, and it gets the cost down to $80 a month. So as soon as that came up, I went right back on it. But for 3 months, I had to go off. I wish they would more,
We struggle with this because we'll say, hey, we tell our patients, here's the best data. We say, start taking this. And then they find out they're not covered, they can't afford it. It's like, well, are we supposed to deliver the proper care when the companies and insurance doesn't provide the ability to? And then you're like, well, now I'm not getting the best care for myself. It's very frustrating. But being off it for 3 months, if you're okay right now, congrats, you're okay. And you were on dual antiplatelet already. You were on Plavix and aspirin. If you fail on aspirin and Plavix, sometimes we'll switch to Eliquis. It's a different form of kind of what Xarelto does. It's just that we don't have the data saying that Eliquis does the same. Okay. The Eliquis and Xarelto data comes from the DVT literature when they compare those two, the blood clots in your veins. Mm-hmm. But we can technically apply that to you. So if you were failing on aspirin Plavix, then I wouldn't have a problem switching to either Brilinta, which is another medication, or Eliquis. So if you're doing okay, you're still on the Plavix and aspirin, which is what we've used for 10, 15 years.
Okay.
It's just that we have newer data saying maybe there's a benefit to using Xarelto.
I'm trying hard to get, because Janssen told me that, well, if you order a 90-day supply in December, that will get you through. So I'm trying to work with them and work through this, but it's like a juggling act because it's so expensive with all these drugs, and I'm on quite a few drugs. So
sometimes, Kim, I wonder if Janssen will be willing to come help you with distribute. I'm sure you worked with them, but they always are looking at how they can outreach to patients. They have always trying to reach out meetings and stuff.
We're actually a partner with we're a partner with their Save Legs Change Live program. And so when they go out there and they do the testing sites across the US, every single patient who ends up with a positive result ends up with our number for the Leg Saver hotline to be able to call in and get support and get direction on next steps. So good call.
But Nancy, at least you're on the double therapy, which we've been doing for a decade and a half. So you're not being treated. And a lot of patients who have P.A.D. never were on anything, and they don't progress. So we do it because we think it'll prevent some things.
Yeah, I have a good vascular surgeon. I go to Dr. Antizana, and but I have coronary artery, had a heart attack, I have diabetes, and I have peripheral artery. But I'm fighting hard. So
good for you.
Yeah, but it's a struggle with all of the medications that I'm on and trying to get financial aid because I'm on Repatha, which is very expensive. So, it's hard when you're on Social Security. So,
and I think there's so many people that can relate to that. Thank you so much, Nancy.